Hi, welcome to this tutorial. We're going to cover different types of running sutures, starting off with simple interrupted sutures, and then we're going to talk about the horizontal mattress, the vertical mattress, and finally the running deep bury suture. So it's a little bit challenging to show you some of these sutures using this model here because I don't really have a lot of real estate to really do the sutures. So what I'm going to do for this tutorial is show you other ways that you're able to practice these stitches in an economical fashion. So here in front of me I have felt. So I picked this up at Walmart and I believe each sheet costs less than $1. I'm not sure exactly how much it costs, but I basically sutured up three of these to kind of mimic what like muscle, fat, and skin. I do not think this is very accurate in real life, however, because look how thin these layers are. I think it's really just good for practicing technique as you're able to really work in a confined space. But other than that, it's really just for technical purposes. If you're a medical student and or something alike where you have access to being in an OR, I would highly recommend you ask the surgical technician if they could give you any of these towels they're not using surgery, because you can use these edges to really practice your technique and it's affordable. Another piece of material you could use to practice is some sort of rag. Here I just have some rag. I picked these up like at Sam's, for example, and you can just use one of these and cut the sutures in between to practice bringing these edges closer together. It is much simpler to practice these techniques than anastomosis. As you can see, the tools that we need are pretty simple here. We just have a pair of needle drivers, some sort of adze and forceps, and I really want you to get in the habit of using these when practicing some sort of running suture, because in real life, you're going to end up grabbing the instrument that you practice with the most. And I'm telling you from experience because I got really used to working with this DeBakey forceps, and I ended up grabbing these in the operation ones to close skin, and that was the wrong instrument, right? The resident told me, "Hey, Mark, you can't be using these in the skin." It makes sense, right? From now on, I really make it a habit to work on the correct instrument for what it is that I'm doing. Remember, anytime you're working with the dermis or you're working with anything that has to do with grabbing the skin, you really got to make sure you're using this, okay? Now, as far as the sutures, you can use whatever you want. I highly recommend you use some sort of braided type of suture just because it gives you so much control, and they're very easy to work with compared to monofilaments. Remember, monofilaments have so much memory, so whenever you try to manipulate it, it wants to go back to the state that it was before. As opposed to this is just going to take the shape of whatever you want it. And I found this is expired, so no longer used. Alright, I'm gonna go ahead and use a monochrome instead, just because it contrasts a little bit easier with the skin here. I do want to preface by saying that from what I've seen, usually in the OR, maybe in the ER, since the skin is so prone to getting infected, they typically use some sort of monofilament when taking a transepidermal approach to suturing the skin together, right? Instead of using some sort of vicryl, right? Because the vicryl, the polyfilaments, they're gonna have little crevices that bacteria can collect, and this one doesn't. It's just like fishing line, right? Okay, so to begin simple running stitch, I'm gonna first locate the apex, and what a resident told me is that your anchor stick should ideally be a little bit above the apex, so every single bite that you're taking for sure is closing the skin incision, as opposed to starting after the apex where you get a little bit of a hole there. So I'm gonna take the bite here, and I'm gonna go ahead and anchor it down, okay? In the OR, or if you have someone helping you, it's very important that whatever edge is up is the one you want to cut. So in this case, I want to leave my long end free, and I just want to cut the tail. So this tail is going to go straight up to the sky. For whoever's helping me can go ahead and cut it and leave a little bit of a tail. So whoever is going to cut this stitch in the future has something to work with, something to grab onto. Now, as far as a running stitch goes, it really is just a straight, you're always biting straight across, all right? There's different ways of doing this, but this is what I've seen most consistently in the hospital. You're just gonna go straight across. You want you want to make sure that you're grabbing the skin edge and reflecting it, and you want to make sure that you're going at 90 degrees into the skin and coming out this way. If it is possible, take it in one bite. Some attendings do not like that and they'd rather you have it in two bites, in which case you just modify your approach and just take it in two bites. It's really not too bad. If you want to take it in two bites, it'll look something like this, where you kind of bite it there, you grab, you keep your needle driver supinated, sorry. Instead of pronating and twisting, you just keep it in this orientation. That way you can quickly grab onto the skin on the other side and go right there. The idea is that you're always going straight across and you want to make sure that you're pretty even with your bite. So I'm biting here and I want to be even. This one's not as even. So I think in order for this one to be even with the rest of them, I have to go somewhere around there and just go straight across. And you just want to run it all the way down to the edge of the wound. So we can pretend here that we're at the end, the edge of the wound. What you're gonna do for this very last bite, if you want to end it, what you can do is just take a backhand, okay, and go very close to this last exit. So the exit for the stitch is right there. So I'm just gonna take a bite here and go straight across. What that sets me up to do is to be able to close this incision without much tension. So I'm going to go ahead and grab this loop like my new edge, and I'm just going to treat this loop like if it was a piece of suture like any other case. Once you're done, go ahead and present these to the sky. So I typically grab the very tip of this loop and present it upwards. That way I'm able to go in and cut and leave a tail there. One of the most important principles here, and this goes for all stitches that involves closing the top layer of the skin, the epidermis, is that you really want the edges to come across together without much tension. You don't want to strangulate them. You don't want them to be squished together. You just want them to come together real nicely, so inflammation and all those processes can take place and help the wound close naturally, right? The next throw I want to show you is going to be the running horizontal mattress suture. So in terms of clinical applications, I have not seen this type of closure very often. I've really only seen it with ear surgery, where the surgeon went behind the ear, the posterior auricular approach, to go inside of the inner ear, right? And to close that incision, I saw that the resident did a running horizontal mattress after doing the deep dermal stitches, bringing that dermal layer nice and close together. So let me show you how this one works. The common theme is that they're all going to have a anchoring stitch. So the very first throw that you're going to do is always just going to be a simple stitch here. However, you're only going to cut the tail. You're not going to cut the other end. So here I'm pulling with my left hand to make sure that I do not waste my suture. Pulling this up, that way I can cut it here. Alright, so horizontal mattress. It really is just horizontal mattresses on both sides. As you can see in that schematic, we're gonna be able to come here, come straight across. We're not locking this one. If you lock it, you're gonna go in between the loops, but that's for another day. You just want to keep following this pattern all the way across the wound. So in this case, here's a wound edge, right? I'm gonna come straight across, and the same on the other side. Backhanded. This one's gonna be front-handed. So I'm gonna go ahead and twist this around. That way I'm loaded front hand, and I can come in over here, approximately the same distance, so something somewhere around there, and I can continue this pattern all the way down. As you can see, this edge, if I pull really tightly, is gonna evert my edges pretty significantly. And that's one of the nice things about this sort of suture, is that everted edges are very good for wound healing. Now that's not 100% applicable all over the body, but when it comes to skin, I think that's generally the theme. From what I've seen, when it comes to closing intestines, right, things like that, there's a suture called a lambda suture, which really inverts the edges, and that's really just to prevent things from spilling out of the gut. But we're not working on gut here, we're just working on skin, so we're just going to continue that all the way through. So again, the very last throw that we're going to do, we want to make sure that we're coming very close to the exit point, because if I do another throw and I start, I'm going to show you here. So if I do something like that and then I start closing my edges together, it's not very pretty. See, we're a little bit at an angle there. So what I want to do instead is do my last throw. I want to be very close to that exit point there in order to bring my edges together in a in a tension-free approach. Right, that way it seems like it's a little bit more straight instead of being oblique. Now an advanced technique here is that instead of going right and left, to go a little bit more efficient, you can go ahead and close it forwards and backwards. Alright, the next one I want to show you is going to be the vertical mattress suture. So, like always, the very first throw is always going to be an anchoring stitch. So I'm going to go ahead and go ahead and anchor this one first. Bring my tail up so I can close it. After my anchoring stitch, what's really weird about this one, the running vertical mattress, is that I'm actually going to go in where I came in for the first anchoring stitch. So I came in here, I'm going to go ahead and pass my needle again through that side, and I'm going to advance it to my other wound edge at an angle. So I'm coming across diagonally to come out right there. Hope you can appreciate that. Now, I didn't mention this, but this first stitch needs to be a big bite, okay? So I need to leave quite a bit of an edge here in order to do like a far near approach. So this is a theme. On one edge of the wound, I'm going to be advancing at an angle. The other one is going to be straight across. So on my left side, I'm going to be diagonal, which means that in my next throw, I'm not going to go straight across. I'm actually going to go in close to the wound edge, very close on both sides. So this is going to be my near throw. I'm going to go ahead and turn this over because I'm going to do a far throw. Okay, so this one's at an angle. This next one, far, right? And it's going to be straight across this one. So it's going to be around there. And this length needs to match this length. So if I'm coming across that much, it means that I need to come right there. I'm going to load this back-handed now. And you see the first one diagonal, this one straight across. I'm going to go ahead and take a near bite on this next one at an angle. So not straight across, a little bit down, and very close to the skin edge. Go ahead and flip that over. Now I'm going to come straight across this one here and take a big bite on both sides. Now I'm going to advance my needle for this next throw right here. Near. And then this next one's going to be far. Far, straight across. So it's going to be there. Going to run this far on the other side. So I'm going to keep running it like normal here. I'm going to take a small bite here. So near. And the last one being far. So once I have this sort of configuration, you know, let's say I want to finish my wound. So I'm already at the very edge here. So what I want to do is that I want to make sure that this ends symmetrically, right? So if I'm far on my left side, I'm going to go ahead and take another stitch here backhanded close to where I came out of. And I want to make sure I match the distance on the other side. So I'm just going to come across straight over there. And once I do that, I can go ahead and finish my wound here. So I'm just going to grab the tail there, the loop, and close it. So straight to the sky, and go in, and cut. Alright, so those are the three stitches that I want to show you. The last one is going to be the deep verted. So the deep verted suture is something that I've seen in general surgery when it comes to closing the abdomen, like the linea alba of the rectus abdominis. That's where I've seen it done. However, they use this special type of needle. They use something like this. So see how big this needle is? First of all, it's tapered, right? So there's no edges. And I already messed this one up, but this one's supposed to be closed together. So it's really two stitches coming out of this one, as you can see there. And at the very end, it's supposed to be joined, but I cut it in half just because. But what it really allows them to do is do the first throw, pass it through the loop, and they don't have to throw any knots. And they're just going to keep running it till they get to the very end. No, well, actually, they're going to get to the middle of the abdomen. And by that point, the other resident is doing the same thing, but on the opposite way. So they meet down the middle and close those two off to create a very tight closure of the abdomen. in order for the abdomen to not open up again. So what I want to do is just show you here between these two rubber bands kind of the technique. I won't be able to really close them down together because there's so much tension here, but it's really just to show you the technique. So the very first stitch here is always going to be an anchoring stitch, right? So we're going to go from deep to superficial, and then from superficial to deep on the other side. Making sure that your tail and your needle are on the same side. So since my tail is over here, I'm gonna sweep it over here, and I see where it is. I'm just gonna close this without much tension, so something like that. You can actually slip this. So the way you slip with an instrument is that your instrument goes up and your finger comes down, right? And that really allows you to bring the tension. The problem is that your tail's gonna end up being long, so you end up wasting a bunch of it doing something like this. In surgery, it really doesn't matter too much because it's you gotta use whatever instrumentations and technique to achieve the best result, and this is a reliable way of closing things with tension using the instrument, right? But when it comes to practicing at home, you're gonna run through your materials quicker, so something to keep in mind there. So once we kind of have this down, we're just gonna follow that deep to superficial and then superficial to deep pattern all the way down, right? So we're just gonna keep doing that, and we're always gonna our next bite is always gonna be straight across this one. So it was here, so now I'm gonna bite here. So I'm gonna pass this through, as you can see, and then next one's here, and then I'm gonna bite right there. So that's basically the pattern. Once you want to finish it, you really just take whatever edge is here at the very end and just use some instrument ties and then tie it off that way. From what I've seen in abdominal surgery, once they really want to close those edges with to make sure they're watertight, right? You don't want contents from the stomach to be leaking out of there. So they use hand ties from both ends. They cut the needles off, right? Just to make sure they don't stab themselves. But essentially, that's the technique. Yeah, once you're done, present it upwards, and then whoever's helping you can cut those off for you. Alright, well, thank you so much for watching this video. I really hope this is helpful for you.